Hey, my name is Dr. Shawn Tierney, and I am a musculoskeletal sonographer. I'm a specialist in musculoskeletal ultrasound, and by default, I'll become a specialist in regenerative medicine as well. With musculoskeletal ultrasound, we have the ability to see things in ways that we couldn't see them before. What I mean by that is that we can see within the body with a tenth of a millimeter accuracy in real time with about 2.5 times the resolution of an MRI. Now, it's not better than an MRI, but it does see through bone. Does not see through bone as an MRI sees through bone. So MRI sees through bone very clearly, but MRI is a formatted image. So with the advantage of musculoskeletal ultrasound is that we can see things in real time and diagnose things in real time in a way that we couldn't do before. So we can see a structure, we can push on it, we can pull on it and see if that's an unstable structure, if that structure is painful when we push on it. And if we're not sure if that structure is causing your or somebody's particular problem, we can be very accurate by guiding a needle with a tenth of a millimeter accuracy to the place that we believe is causing the pain or disability, and do a diagnostic injection to clearly identify that that particular structure is the cause of the patient's pain or your pain. So musculoskeletal ultrasound has the ability to do things and to define things in a way that we haven't before. And what I mean by that is that when you have a surgery, it's nice if you know that the surgery is going to work. When you have a medical procedure, it's nice if you know that procedure is going to work. And the way to know is that by knowing that what that surgery is being done on, or what that procedure is being performed on, so far as the structure that surgery is being performed on, or the structure that is being injected or regenerated with regenerative medicine, is actually the cause of your problem. So now we can very accurately put a small amount of local anesthetic on a structure, have you move around, and if that structure is no longer painful, then we know that we have identified clearly the cause of your pain and disability. And we may find that there's another structure involved as well. So we can go ahead and pinpoint each individual structure diagnostically by looking at the structure, by doing diagnostic injections to define if that structure is the cause of pain or disability. Then we can move forward with eliminating your problem in the most cost-effective way. So it's a very honest, a very clear, concise diagnosis, and a very honest, very clear, very concise treatment can be delivered. Because just as we can see things with a tenth of a millimeter accuracy, we can guide an injection or a surgery with a tenth of a millimeter accuracy as well. So that accurate, clear injection, that accurate, clear diagnosis is what I offer. I'm a specialist in that field. So being a specialist in the field of musculoskeletal ultrasound has led me to learn more and more about regenerative medicine. As I started working with stem cells in 2011, and PRP, and then placental-derived stem cells and placental matrices over the past 3 years. Somehow it happened that I became a leader in that field, and I lecture on that several times a year, just about every month. It turns out that now I'm a person who can guide these procedures. I don't do the whole procedure myself because it's under my license. That's not something that I do, but I do guide the procedures and help other doctors and other specialists deliver the highest quality care to patients. So it's great that we have the availability here to offer this high level care. Okay, so now I'd like to talk to you a little bit about what we can do procedure-wise to help somebody get better very rapidly using musculoskeletal ultrasound and ultrasound-guided procedures. So one thing that we can do is we can look at a nerve. Sometimes when we look at a nerve, you can see a nerve that's very enlarged. So when a nerve is irritated, it may swell to become 2, 3, 4, or 5 times the normal size. If the nerve is very enlarged, that usually indicates that the nerve has been irritated or compressed or injured in some way. So as we look at a nerve with musculoskeletal ultrasound, then we may be able to define that where the problem in the nerve is located by the nerve being very large or compressed in some way. So sometimes a nerve may be round and all of a sudden it's very flat. That can be an indication of an issue. And the next issue that I think I would do to define that nerve problem is actually where I think it is, it would be a push on the nerve. So I can just push the probe into the nerve and I can ask the patient if that's tender. And if it is tender, I can ask them which place along the nerve is the most tender. So if I've identified what part of the nerve is the most tender and looks the most abnormal and is the most likely to be impinged, then I can use water injected from a needle that's right next to the nerve to stretch the material off the nerve, to separate the connective tissue from the nerve, to create more space for the nerve. So if a nerve is symptomatic, if a nerve is a problem, then usually what's happened is the nerve is compressed and the blood supply to the nerve is altered. So that compressed nerve that has an altered blood supply or not enough blood supply is going to become painful and dysfunctional and damaged. So the longer that goes on, probably the more damage there could be. Hopefully there's not enough damage that there's loss of permanent strength or permanent motor or strength or permanent sensory capabilities. But most of the time, if we catch it early enough, we can decompress that nerve so that the nerve can recover, oftentimes the next day. So you can have a lot, or right when people get off the table. It's not unusual. I mean, once every week or two, we'll have a patient come in that has so severe nerve compression that's impinging and interfering with his ability to use his hand or his leg, and they lost grip strength or dexterity in their hand, and we hydrodissect the nerve, usually in the neck, in the brachial plexus, or as the nerve comes out of the spine, and immediately we have restoration of strength and function. So that's it's a life-changing, life-altering procedure. If the nerve is still damaged and not completely recovered, then we can add some stem cells or some placental matrix or some other regenerative medicine procedure to stimulate that nerve to heal. And we can do all this with a 10 to the millimeter accuracy. And we can get next to the nerve without hurting the nerve, without impinging the nerve, and create, remarkable relief in a very, very short period of time. So that's what we call hydrodissection. So we do that commonly in the wrist, the median nerve, and the neck, multiple places on every nerve there's potential for impingement. So we're constantly understanding where the nerve is impinged, understanding where the nerve goes, and doing a precise injection to relieve that nerve pressure or nerve injury. So the next thing that we do a lot of is we do a lot of regenerative injections. So one of the things we do in the regenerative injection is we'll inject into the area that's not healing. If it's a tendon or a ligament, we might needle it a little bit to create more holes and more stimulus for healing. And then we can add the stem cells or placental matrix or PRP or whatever is necessary or most effective for that particular tissue to heal. So that what we call a percutaneous needle tenotomy, or needling the site of injury that is not healing, can make a big difference. So we needle it and then we put the regenerative medicine substance into that tissue, but via guided injection, watching the whole procedure with 1/10 of a millimeter accuracy or greater, and usually we have fairly good results. The next thing that we do with ultrasound guided injections is just simply guiding an injection to either block a nerve, just being next to the nerve to block the nerve, or just being into a tissue that's not healing, like a joint or a meniscus, to just simply put the desired regenerative medicine substance into that tissue. So it's very effective to have an extremely accurate ability to inject any tissue very, very safely, very effectively. And the nice thing about using musculoskeletal ultrasound is we can see the blood vessels, which could be a potential problem. And the potential problem for a blood vessel is that one thing is that if you or to break that blood vessel, you can cause a hematoma or a bruise, which could be damaging if it's against a nerve and compressing the nerve. It also is a problem if you were to inject something into a blood vessel that maybe wouldn't be good to have in a blood vessel, like a concentrated local anesthetic that could put somebody into a general anesthesia very quickly, or a substance that maybe wouldn't fit through all the small capillaries and cause some vascular damage or some infarcts in some parts of the body. So with musculoskeletal ultrasound, you avoid the chances of those happening because you have the ability to see those structures. Any blind injection has a risk that is much higher than a guided injection. Blind means you don't see what you're doing. There are kind of blind guided injections too. So I call a fluoroscopy is kind of a blind guided injection in a sense, because you can see the bone, and when you inject a dye, you can see the vessels or see where the dye is going, but you don't see everything. You don't see, you can't see the nerves. You can't see all of the vessels unless you inject them. You can't see the muscles, you can't see the tendons. So in many ways, fluoroscopy is a blind guided injection, whereas ultrasound is a guided injection with probably the highest visibility that you can do in real time. The other option is a guided CT scan, which is going to be put the needle in and take a picture, put the needle in and take a picture. It's not as easily to guide as a CT scan in real time. Also, it's a very high dose of radiation to both the doctor and the patient, and there is no radiation with ultrasound. So it's much safer as far as radiation and cancer-causing risks. So let's go into what we use for regenerative medicine. The first thing we started to use for regenerative medicine was using dextrose solution, which is what they called prolotherapy, where they would inject dextrose or some other irritant into the tissue to stimulate the tissue to heal or change its response. There is research that shows that's effective, but it needs to be repeated many, many times, and it ends up costing more money to do that. It's not as effective as using something stronger, even like PRP or placental matrix or stem cells. So something with a more powerful regenerative effect is easier to go through, not to go through it as many times, and is more cost effective for most people. So the next thing that we started to use for regenerative medicine was PRP. As a whole, we started using the concentrated blood plasma. Basically, we would take your blood and concentrate the platelets, and the platelets are the factors that cause the clot or a scab on your skin. And some of those factors, they create that structure, but they also release a lot of growth factors that stimulate healing. So you have this structure along with factors that stimulate healing, and that's PRP. So it's a very effective healing modality. Maybe not as effective as stem cells, but it certainly has a very strong place, and it's very anabolic and regenerative. The next thing that we tended to go to as healthcare professionals of all nature tended to be for regeneration was bone marrow stem cells. So bone marrow stem cells, is when we learned about stem cells in school, that's the stem cells we talked about, because that's where you have from a stem cell to more and more differentiated cells to make your blood cells, different types of blood cells, from red blood cells to white blood cells. So you have this differentiation ratio that everybody studied, and that's starting with bone marrow stem cells that derive the different types of cells in your blood. And the initial thought about bone marrow stem cells was that, well, these are more differentiated, so they can't become some other tissue. We did find, though, in time that when we inject them into an ovary, you have no new eggs. When you inject them into a testis, you can make new sperm where there wasn't any production before. So you can actually, these stem cells can actually become less differentiated than they are. And there's very effective and good concentration of bone marrow stem cells within your own bone marrow. It is an expensive procedure because we have to do two things. First thing, we have to harvest the bone marrow, then we have to concentrate the bone marrow, then we have to put the bone marrow in the desired place for healing. So that's a little bit of trouble. The other thing with bone marrow is it does make you a little bit sore, which is typical with, same as with PRP. The first phase of healing is often breaking down the injured tissue. The anabolic drive of these cells can cause a breakdown of healthy tissue, of unhealthy tissue, before you regenerate new tissue. Kind of like as if you were to drive your truck into your patio. You wouldn't just put new boards over the broken boards, you would take the broken boards off. Well, that's that inflammatory breakdown, and then you start to put new boards back on. That's the regeneration. So we thought that that was a really good thing, and we've been using that for a long time. We still use it today. The other type of stem cells that came about was using fat stem cells. There's a lot of stem cells in fat, and physicians can do liposuctions. And with a liposuction, you can then take that fat, break the fat down, concentrate the stem cells from the fat cells, and have a very effective anabolic cell. The FDA does have a problem with us separating the stem cells from the fat, so it can become an issue. It also requires a liposuction to do that. So for a plastic surgeon, this is an amazing thing, because you can use those cells that you take out to do something fantastic. If you're not already getting a liposuction, then you have to get a liposuction. And a liposuction, if you ever had a liposuction, is not something that's easy to recover from. In fact, it's very, very sore, and it may take up to a year to recover from the pain of that procedure. It's borderline legal in the United States for doctors to do. It'd be really nice if we could harvest and grow bone marrow stem cells or fat stem cells and then just put them back into you as you need them. Unfortunately, in the United States and in most countries of the world, that's not legal. And I think it's maybe out of fear of pharmaceutical companies, or a fear of potential problems with those cells. But certainly I think you just have to understand that we live in a capitalism in this country, and capitalism is a great thing. It does have its influences on healthcare, and on laws and regulations. So you are looking at, if you're thinking about just doing one procedure, harvesting your stem cells and then growing them to use as much as you need, there's a little bit of roadblock in that way, and it's probably because of a fear of a loss of market share from other types of healthcare. I don't know that that's true, and I think it'd be a hard argument to say, but there's probably something in truth in there, and certainly wouldn't want to be a part of running into that wall. So we can't really grow stem cells in the United States, so what can we do? Well, we can get this other type of stem cell, not from our cells, but it is legal to use cord blood stem cells in the United States. So cord blood stem cells are derived from the umbilical cord, the cord between the mother and the fetus. There's a lot of stem cells in there, and they're very similar to the stem cells we would get from your fat or from your bone marrow. So these cord blood stem cells, they act like your stem cells. They don't have a reaction with your immune system like other stem cells would from another person, because the cord blood is unique in that it's an immunologically neutral place. It means the mother's body doesn't attack that blood, and the fetus's body doesn't attack that blood, and anybody's body you put that blood into will not be attacked. That blood contains a lot of stem cells, so if we concentrate those stem cells, and you have stem cells that you're not going to get an immune reaction to them. So they're very young, very healthy cells, and you can buy them in high concentrations and use them to regenerate your tissue for a much lower price than you would have to pay to do a bone marrow harvest and use your own stem cells. Although that's not always a bad thing, and also for a lot less of a procedure and a lot less risk. The other thing that we can also use those instead of doing a fat liposuction harvest procedure and then a fat derived stem cell procedure. So the other advantage of these cells is that if we take, say, your own fat, maybe you're not a super young person, those are super young cells. So these older stem cells may be more likely to become cancer. that may be an issue, and that is the government's argument as to why they don't believe that it's safe. There's been no cases of those cells not being safe, but these cord blood cells are considered safer and at least reasonably legal at this point. So we can use cord blood stem cells to regenerate things on you or your family member or friends or people you care about that need regenerative medicine to a certain structure. One thing you wouldn't do with those cells is put them into an ovary or a testes, because then you would have a different genetic makeup. But for those procedures, you can always use your own cells. The other side of medicine that is up and coming right now is anti-aging medicine or hormone replacement. And although we're not really doing this yet, I think the future probably stands with us regenerating those glands rather than taking the hormones, repeatedly for the rest of our lives that those glands would normally produce. So it would be a lot more effective, a lot longer lasting, to have healthy endocrine glands than to have to take a pill every day or have a pellet inserted into your skin every so many months. So those are things to consider for the future, but for what we do, that's not in our procedure is regenerative medicine, using whatever means is most effective. Now, the last type of regenerative medicine modality that we use is a placental matrix allograft. And a placental matrix allograft is where the connective tissue from human placenta and cord is concentrated and sterilized and separated, along with the growth factors from stem cells. So it turns out that these stem cells stimulate growth, and that's maybe more, they may stimulate more growth and attract more of your own stem cells than they actually do work themselves. So these cells come in and they stimulate growth, but the growth factors are within the cells. So you can concentrate these growth factors, put them into a serum or a fluid along with matrix of connective tissue, so you have the factors that stimulate regeneration, the factors that block degeneration, and the factors that block unhealthy inflammation all in the same component, along with collagen, elastin, hyaluronic acid, fibronectin, lanolin, things that connective tissue matrix that your body needs to make new tissue. So that combination also seems to be a very effective tool to regenerate not only joints and ligaments, but also nerves and muscles, and of course tendons. Modalities for regenerative medicine. One would be PRP, or platelet-rich plasma. The other would be bone marrow concentrate for bone marrow stem cells. The third would be adipose-derived stem cells. And the fourth would be cord blood-derived stem cells from placental cord blood. And the last would be placental matrix allograft. So that's placental connective tissue along with growth factors and cytokines that decrease and stimulate the right kind of metabolism to get your body to heal. And the placenta, there's something that we don't want to have happen, and that's inflammation or degeneration. Inflammation could be a problem if the mother's immune system would attack the fetus's immune system. So if the mother's immune system attacks the fetus's immune system, one of them is not going to survive, right? So that's immune systems attacking each other. So we don't want that. And it can't happen. So there's cytokines or factors in those cord blood-derived stem cells or placental-derived matrices, placental matrix allograft, that prevent that unhealthy immune reaction between the mother and the fetus. So it suppresses that unhealthy reaction in your joints if your joints are degenerating, especially if part of that degeneration is related to an inflammatory process like rheumatoid arthritis or psoriatic arthritis or mixed connective tissue disease or just some kind of inflammatory osteoarthritis that we don't understand. It's going to stop the metabolic process that's happening in that tissue or joint. So a lot of times when we have a chronic problem, what's happened is that tissue has changed its metabolic state. So in an ideal metabolic state, we're constantly regenerating, constantly moving forward, constantly healing and being vibrantly healthy. If you have any tissue that's been irritated either from trauma, or accidents, injury, or an immune disease of some nature, or an infection, then you can shift the metabolism to that of maybe deterioration, using cytokines that deteriorate your own tissue. And that process causes osteoarthritis and chronic tendon injuries that don't heal. So we want to address that by using these placental-derived stem cells or placental matrices that have cytokines that block that unhealthy inflammation and change the metabolic state, not only through altering the immune response, but also by blocking the cytokines that would break down those tissues. So, to just reiterate a little bit, if you have inflammation or an injury to a joint, that joint may gradually shift to a metabolic state of breakdown. That metabolic state of breakdown will cause arthritis and degeneration and the future need for a joint replacement, perhaps. So we want to avoid that, and now we have the capability to do that using placental matrix or a cord blood-derived stem cells. Perhaps adipose-derived stem cells do this as well. Some of the bone marrow-derived stem cells do some of this, but the easiest effect, the easiest way to do that is using these cord blood-derived stem cells or placental matrix allografts. So that's the basics of using that cellular-derived regenerative medicine. There is actually a sixth type of regenerative medicine. The sixth type of regenerative medicine is blocking degeneration and allowing for regeneration, which is amazing for very healthy, very vibrant professional athletes, and for example, most of the NBA players that are always stressing their joints because they jump, too much, and they weigh more than the rest of us, even though they're thin-looking. They're 6'8", 7 foot, 6'6". They're getting close to between 250 and 300 pounds, and they're jumping up and down all day long. That's a problem, and it creates injuries within the joints. That creates chronic inflammation. So to get that person to heal, or other elite athletes to heal, or even to block a degenerative process, we have a substance called alpha-2 macroglobulin. It is actually in all of our blood, and it prevents the breakdown of tissue. Blood, of course, doesn't get inside joints and tendons, so that protection from alpha-2 macroglobulin does not occur in joints and tendons. And in some respects, it may not occur within the nervous system as well. So we can take your blood and concentrate the alpha-2 macroglobulin from your blood, filter out all the inflammatory cytokines from your blood, and then inject it into an area that we want to block the degeneration and allow regeneration to occur. A spectacular thing if you have a degenerative neurological disease, a spectacular thing if you have a degenerative joint disease, a spectacular thing if you have a degenerative tendon disease, because if you inject that substance into the tendon from your own body, you can change the metabolic state and allow that tissue to heal. And much like cortisone, it feels better because you block that unhealthy inflammation, usually within 24 hours. So that's the sixth type. So first type, platelet-rich plasma. Second type, bone marrow concentrate. Third type, fat concentrate of stem cells. So fat adipose-derived stem cell, fat-derived stem cell. Fourth is cord blood derived stem cells. Fifth is placental matrix allograft. And the sixth is the alpha-2 macroglobulin, a protein from your blood we can concentrate that blocks the degeneration of tissue and blocks that unhealthy inflammation. So all of those products are best delivered with musculoskeletal ultrasound guided procedures, because with musculoskeletal ultrasound we can guide an injection or a surgery with a tenth of a millimeter precision, and that just seems to be the best way to do things right now. So we have all these modalities, and we have a great delivery system, and we have a great way to diagnose any musculoskeletal, neuromusculoskeletal issue. We might as well use it.